load of great stuff we need to do, but how do we create the business models to release cash and funding to make a lot of this stuff work? And because we spent a long time talking and drawing, we ended up with a very low-tech
slide. Should use a faster pen, sorry. Basically, it was from yesterday sort of high level question of how to do cross-sector business case, which is something that comes up a lot. And in terms of sectors, today and yesterday, we're obviously focusing on flood risk. Similar arguments can be transferred around things like transport and that kind of stuff. And we thought in terms of the sectors, there's been lots of talk about health, and so focus on flood resilience and health and social care sectors. It's a very interesting comparison to draw, and this kind of links into a lot of the stuff that you guys are exploring at grassroots level on the resilience and recovery side, and it's kind of how do you pay for it all, basically. Essentially, there's lots of core flood risk assets that the big capital schemes put in, and at one extreme that's kind of things like rivers and coastal defences and the hard stuff that is actually really important and required. In the health and social care sector, there's obviously lots of things there that are very specifically within their remit, like hospitals, ambulances, surgeries and all that kind of stuff. You get into a sort of space where there's a sort of bit of a morphing over between these two things, where you're getting into sort of social care for the elderly, community level stuff that teams like locality get stuck into, sort of build local community centres. Some of the experimental stuff that's happening in Leeds around health with extending the circle of care using technology and iPads and all this kind of stuff. It all starts to overlap with the kind of things that are emerging, that are what makes communities resilient in and around Turks and all that. Similarly, in the flood risk sector, a lot of these solutions that start to morph out of the traditional stuff into active flood management and getting more into the public space, and then the resilience actions, not just in terms of physically putting stuff on houses, but what is it that make Turks resilient actions. They all start to morph into this kind of central space where you essentially might be getting shared assets. And so it's about how you can start figuring out pounds spent on flood resilience equals potential pounds saved in health and social care budgets. Start to potentially unlock money. At the moment, I borrowed this off somebody in the office who's an expert in this, and I'm not, but this is kind of the Bible of how you fund capital investment in flood risk. So this sets out the economic case for action. Cost-benefit analysis are done according to these rules, and whatever's in the cost-benefit analysis gets kind of done effectively, and what doesn't within the flood risk costs. Obviously, there's a lot of others. That's done at national level and is based on economic returns to the nation, basically. And then there's this whole thing about the regional scale considerations of investment and funding costs. We've just heard about catchment scales and other boundaries which may not align with economic or political boundaries. And then you right down to the sort of individual household, street, community and person. At the moment, this takes a lot of things into consideration at a real sort of macro scale, but there's probably a limited extent to which this really nuanced stuff kind of feeds back into the national scale. So there's a scale analysis thing there. Basically, this document here does cost-benefits analysis based fundamentally on the economics around flood risk. It is very good in terms of acknowledging a lot of the intangibles around health and well-being and that kind of stuff. It only goes so far though. It's based primarily on property, loss of property and those kinds of things. And there is an acknowledgement of the costs to things like stress and health and well-being. But the nuances between those things are relatively unrefined. So I think there's potentially quite a lot of leakage off this cost-benefit analysis. If this is primarily the flood risk and you've got health and potential benefits to the health sector here, there's probably a chunk of stuff which is effectively leaking off the end of the spreadsheet and not coming to the cost-benefit analysis. For example, if you've got a deprived area with low cost of property, the economic case for investment might be slightly lower in flood risk stuff. The actual cost to the system of actions in there might be much higher because there's a high dependency for recovery on state services and that kind of thing. It's very, very complex, and some of that's taken into consideration here with factors which compensate for that. But it needs more work. And people like Joseph Ramsey Foundation do some great work on that, the climate justice stuff, and I know they're drilling into that. So basically what we're saying is we need to understand these links better between the flood risk and impacts on health and social care. If this graph here is the increasing flood risk going forward, and this is the increasing cost of social care going forward, what are those connections? Do we understand them well enough? And then, do we also understand the resilience of the system? So just in that regard, take a couple of examples about tipping points. A person who's maybe in a home, self-sufficient, maybe an elderly person, not dependent on the state particularly, but a small or minor flooding event might tip them over the thresholds that they're unable to recover and end up in care homes for 10 years longer than they would have otherwise been. At the moment, the costs in here for stress on health are something like £277 a year per property. There are other things in there as well, but in putting in perspective, the cost of going into care is something like £37,000 a year. What are the actual true costs of some of these things leaking out into social care from the cost benefit? On the business side, and the case study might be the businesses, for example, that just left Leeds, unfortunately, because this event was just enough to tip them over the boundary, and they've made the decision that it's best to relocate. What's the resilience of the health and social care budget to those kinds of tipping points? This is obviously high-level questions. All the kind of stuff you guys are doing will probably feed into data sets. In terms of practically what could be done, we think that what we need to do is build on a lot of investment that's already been done in this area. Clearly, we need to refine the question. We're asking very high-level questions. We need to refine potential study areas and pilots, and then we think we can build a tool. And an obvious starting point would be the public health, something like the Public Health England SHAPE tool, which has been received 10 years worth of public sector investment. It's a fantastic tool with loads and loads of healthcare data feeding into it from HSCRC. It was demonstrated here a couple of weeks ago, and has the capacity to build simple dashboards onto that tool to answer specific questions. It's currently available to public health practitioners within local authorities, but it's not currently available to other public sector bodies like the Environment Agency. So we think that actually there's a practical way of trying to get some of this cross-sector business case work done by building on this massive tool that exists in the public sector, finding some clear questions and pilot areas, and creating some dashboards which could then feed into, for example, these guys could have their own dashboard, people doing joint needs assessments could have a dashboard, CCGs could have a dashboard, which give them a better business case. Potential other party, people like Joseph Ramsey Foundation, obvious, doing some fantastic work. The agency themselves, I believe, are doing work on health impacts. Obviously, the university, DEFRA. There's the whole sense of parts, and our proposal here is it's a high-level question. The next step is probably to get some of these key players together and figure out how we can start to actually generate some evidence for this cross-sector agreement. That's it, really. That was 2 hours, wasn't it?
It's fantastic. Well, just before we give a full round of applause, the last bit is that we are going to build something. Yeah. So last couple of weeks ago we saw the SHAPE tool that Public Health England have spent 10 years building. It's fully available to all public health bodies or people in the public sector using it. When you see it work, it's a great visualization tool. It renders really quickly, it's fabulous maps, and you click and play with data sources from the public sector, and they were using it to map where they make investments in terms of health infrastructure, GP surgeries, hospitals, where it goes. They was playing with flood risk data, but they really didn't know what they were doing.
They were using flood risk data to assess the risk to their own assets. So answering questions about vulnerability of their services and assets that they've got capacity to, but not necessarily yet. And they have the agency had agreed to share the flood risk after quite a long negotiation, but they're not yet particularly answering questions back out of the health sector. So flipping that on its head. If this could become an engine, which you could quite simply layer simple dashboards and questions over, and you can kind of hit the ground running. but some of the insight that you guys have developed through these bottom-up processes, like the recovery, the list of recovery questions, for example, if they can become data sets which say these are the kinds of assets and actions we need to do to increase community resilience, this is how much these sorts of assets will cost. What you've then got is, for example, when we were talking yesterday about the Environment Agency flood wardens needing a better network, maybe they actually should be the same people as the locality guys going out and trying to work in communities, or the people putting iPads in elderly homes to give them more resilience and connectivity should be the same people who are trying to warn people. So there must be places where we're spending money twice or not spending it at all. And it's just finding those little crossover points or big ones.
So we need to build something that demonstrates a business case that can pay for all the stuff that we're talking about. So that's sort of taken on to one of my jobs, and I'm going to